Hey there, welcome to Medical Monday. Dr. B here with another question I get asked a lot is children with concern for a urinary tract infection, maybe burning when they pee or kind of jumping up and down when they have to go to the bathroom, or you're smelling something funny in their diaper, or they're acting funny and you're worried about a urinary tract infection. When you're thinking about this problem, probably the most important thing for you to differentiate is, do they have fever? If they have fever, they really should be seen, and we need to get a urine, check a urinalysis, and check a urine culture. So let's make sure if they have fever, you should bring them in. If they don't have fever and they're just having some discomfort with urination, one of the things you can do at home to maybe avoid coming in is to do a vinegar sitz bath. A vinegar sitz bath is particularly for little girls. For boys, it's not as much of a problem, but for little girls, typically all we need to do is put them in about 1 inch of warm bath water and put in 1 cup of white cooking vinegar, like apple cider vinegar or whatever. Just put 1 cup of vinegar in 1 inch of bath water, soak for about 10 minutes. And what this does is the acidity of the vinegar, because it's low, pH low, and usually when little girls have vaginitis, they have a high pH, vaginal pH, and when we do a vinegar sitz bath, we neutralize the pH, and it's like Johnson's baby shampoo. It makes no sting in your eyes. And so what happens is it actually takes the stinging away. And you can do that in the morning and in the evening, twice a day for a day or two, and oftentimes that will relieve the symptoms. One of the major reasons little girls have this problem is when they sit in soapy water. If they're used to taking baths and they put some bubbles or shampoo in and create their little bubble bath, they're having a great time, but they're very likely that soap is a high pH and it's going to raise that vaginal pH, and then they get stinging. And that high vaginal pH also promotes yeast growth or a yeast infection. And so when we do the vinegar sitz bath, yeast hate vinegar. And so when we get that lower pH, it usually resolves the problem. So something easy you can do, you probably have that stuff at home, you can try it. As long as there's no fever, no harm, no foul, go ahead and try a vinegar sitz bath or two and see if you get some relief for those little girls. Let's make sure they're not sitting in soapy water. They can sing and play with their toys and be in the clean bath water until they're about ready to come out, and then soap their hair and their body, rinse them really good, and they're gonna be just fine. So if we do a bath bomb or a bubble bath, and occasionally you have to, then just do a vinegar sitz bath afterward and you'll avoid the vaginitis. So keep that in mind for those little girls out there who are frequent flyers in our clinic for this problem. And it's a very serious problem if they're misdiagnosed with a urinary tract infection, but they really have vaginitis. They get started on antibiotics for no reason, and really we could have avoided the whole thing with a vinegar sitz bath. And so just a tip for those little girls out there with this kind of a problem. Have a great Monday.